with, I would perform hand hygiene. I would introduce myself. My name is Bailey. I'm here to do a head-to-toe assessment. Can you please tell me your name?
Lauren.
Okay. So I'm seeing a well-developed, well-nourished 29-year-old male who has no visible distress, no acute distress on initial presentation. I'm going to go ahead and assess for his orientation. So we already got your name. What's your date of birth?
July 10th, 94.
Okay. What year is it?
2024.
Okay. Who's the president?
Biden.
And where are you?
My kitchen.
Perfect. So he has A/N times 4. His speech is clear and coherent at this point in time. The next thing we're going to do is assess for muscle strength. So I'm going to go ahead and have you press against my hand here. Okay, same thing that way. Back against my hand. Press against my palm. Okay, I'm going to have you shrug your shoulders up into my hands. Perfect. Okay, go ahead and reach your arms out in front of you. I'm going to have you squeeze my fingers. Perfect. Pull me towards you. Okay, now push me away. Perfect. I'm going to do the same thing with his feet down here. I don't know if it's super visible, but go ahead and push me away from you and pull me towards you. Okay, so muscle strength is equal bilaterally. It is a 5 out of 5 and symmetric on all body parts. So we're going to go ahead and move on to sensation. So the next thing I'm going to have you do is close your eyes and tell me if you feel a sharp or a soft poke here.
Soft.
Okay.
Soft. Sharp.
Okay.
Sharp. Sharp. Soft.
Okay.
Soft. Sharp. Soft. Sharp. Soft. Sharp.
All right. So sensation is intact in all 4 extremities. He was able to accurately pick if it was sharp or soft. We're going to go ahead and move on to the reflexes at this point in time. Let me get my reflex camera. So the first thing we're going to start with is the bicep. I'm going to have to move to this side of you to do this. So I'm going to have you rest your arm like that. And this is checking for the C5 and C6 nerves to be intact. I'm going to check the other side. Okay. The next thing we're going to do is check the radial. And this is checking for C7. And the same thing on the other side. Just let it dangle. Okay. Then we're going to move on to the radial brachialis here. This is checking for C7. No, this is checking for C6. We're going to do the same thing here. Okay. We are going to check for his quadricep and knee-jerk reaction here. So I'm going to have to get down here. And this is checking for L4. Okay. The next one is going to be the ankle reflex down here. So I'm going to support here. We're going to hit right here. This is checking for S1. And do the same thing on this side. And then we're going to check for the Bushinski reflex on both sides. All right, so all of his, I don't know, it's not even visible. Bushinski is here, and then the ankle is right here on the back of his ankle, where the shoe would be. So all of his reflexes are intact and normal bilaterally. They're equal to each other. Nothing is jumping out as significantly more reflexive or less reflexive on different sides of the body. The next thing we're going to do is have you go ahead and stand up for me. So stand up straight. Okay, so the station is normal. I'm going to have you walk away from me normally. Okay, turn around and walk back towards me using your heels. Okay, now turn around and walk away from me using your toes. Alright, and then one last time back towards me with a heel to toe pattern, basically like a field sobriety test. Perfect, you can go ahead and have a seat again. Alright, so his gait is normal, his station is normal, and he has a normal tandem gait with his walking there. The next thing we're going to do is assess Perla. So I'm going to have you take a look straight ahead. I'm going to shine a light in your eyes here. Alright. Perfect. And now just take a look at this pen for me. Alright. So his pupils are equal, reactive, round, and responsive to light and accommodation. I'm going to go ahead and continue to assess the rest of him from the head to the toes. So we're going to watch his breathing. He doesn't have any nasal flare while he's doing that. I don't see any circumoral cyanosis. I don't see any pursed lip breathing going on while I'm watching him. When I have him, when I take a look at his nose and mouth, his mucosa are moist and pink. I'm going to also watch his breathing pattern on his neck here when he's breathing. I don't see any accessory muscle use. I don't see any jugular vein distension on either side. The next thing I'm going to do is palpate his carotid. Okay, so his carotid are both palpable, they're normal. I don't feel any thrills when I palpate them. I'm also going to listen to his carotid. While I'm listening to your carotid pulses, I'm going to have you hold your breath and not breathe for me so that I can hear the pulses. So go ahead and hold your breath for me. All right, I do not hear any bruit when I'm listening to his carotid. The next thing I'm going to do is go through his chest. So I'm going to have you take your shirt off for me for a moment. So looking at the contour of his chest from both the front and the back, I do not see any barrel chest. I don't see any scoliosis. I can't see any pectus carbonatum or excavatum. I don't see any shortness of breath, dyspnea, any accessory muscle use or intercostal retractions occurring. I also don't see him sitting in the tripod position and looking like he's labored breathing. So we're going to go ahead and say that all of our visual inspection of his chest would be normal. The next thing I'm going to do is palpate his chest. I'm going to do 6 spots on his back here posteriorly. Okay, we're going to do 4 here. Alright, so when I'm palpating, I don't feel any masses, any displaced ribs, any kind of abnormalities to that. Do you have any tenderness when I'm doing that?
No.
Okay. So the next thing I'm going to do is listen to his lung sounds. I'm going to listen to 8 areas on the posterior, 6 on the front here, and I'm also going to listen to 3 on both the right and the left side. that for me. Same thing on the other side. Okay, so while listening to his lungs, I don't hear any crackles, any rales, any rhonchi, any abnormal breath sounds while I'm listening to that. There's no wheezes. So the next thing we're gonna do is inspect his cardiac heart region. So when I'm watching his chest here, I don't see any heaving or any evidence that his heart is pounding. There's no abnormal movements to that. I'm gonna go ahead and palpate the 5 areas here over his valves and Erb's point. And the apex of his heart is located at the left mid-clavicular line at the 5th intercostal space. I can feel that that is the strongest sensation of his heart. The next thing I'm going to do is auscultate those same areas, the same 5 areas. I would listen to them with both the belt and the diaphragm of my stethoscope while he's both sitting and standing to see if I hear any murmurs or any abnormal heart sounds. And if there's like excessive breast tissue or if he was obese or there was some kind of difficulty in accessing those points, I would have him lay in the left lateral decubitus position so that I can better access those heart sounds. For the purposes of the demonstration, I'm only going to use my diaphragm to listen to those 5 sounds. All right, so I hear a normal S1, S2 cardiac pattern. There's no murmur, no rub, no gallop, no abnormal S3 or S4 sounds are present when I'm listening to his heart. The next thing I'm going to do is check capillary refills. I'm going to borrow your hands for a second. I'm going to squeeze and watch the response time on him getting blood flow back to his fingers. I'd also do the same thing to his toes down here. Okay, so his capillary refill on both sides is less than 2 seconds. He has normal capillary refill in all 4 extremities. We're also going to look for peripheral edema while we're doing this. So I'm going to check and see if he has any pitting. So there is no pitting or evidence of swelling in any of his limbs. He has no peripheral edema present at this point in time. We're also going to go ahead and feel all of his pulses. So we're going to start here with the brachial. We're going to do that on both sides to compare them to one another. We'll move on to radial pulses. Perfect. I'm also going to move on to his femoral pulses, which we would palpate, but we're going to skip for the purpose of the demonstration. We're going to go for popliteal here behind the backs of his knees. I'm going to move down to my tibial, posterior tibial pulses here. I don't think that's visible. I'm going to lift your foot up, I'm sorry. So down here on the side of his ankle. And then same thing, we're going to do the dorsalis pedis on the top of the feet, both sides. So all of his pulses are equal between limbs. They're all 3+. For the sake of the demonstration, we're going to say that his femoral pulses are also 3+, equal bilaterally, symmetrical. We're also going to feel for temperature in his limbs. So his limbs are warm to the touch in all 4 limbs. We're going to move on to the abdomen here. So we're going to start by visualizing the abdomen. When we look at the abdomen, it is slightly distended, but there is no visible like peristalsis, no visible movement. There's no visible hernias or anything like that that I can see, or heaving going on. I'm going to also assess around his umbilicus, and I don't see any visible veins around his umbilicus. We're also going to auscultate his bowel sounds while we're doing this. While I'm listening, I can hear normoactive bowel sounds in all 4 quadrants. While I have my stethoscope out and turned on, I'm going to go ahead and listen to his aorta and his iliac, renal, and femoral arteries. Okay, so while I'm listening, I cannot hear any bruit there. While I'm listening to his abdomen or his arteries. So I'm going to go ahead and palpate all 4 quadrants next. Okay. Palpating, I don't feel any masses. Do you have any tenderness?
No.
So there's no tenderness, no masses, hernias, anything palpable there. I'm going to percuss his abdomen next. And this is easier to do with him lying down, but all we have is a flat dining room table. But while percussing his abdomen, I don't hear any abnormal percussive sounds. Everything is the normal sounds that you would expect from the different quadrants as we do that. And that is the conclusion of the head to toe assessment with perfect findings.